your antioxidants, which kind of donate the electron to that free radical. So what's the importance of nerve-2? It fights oxidative stress, and oxidative stress is both caused by neuroinflammation and also by those free radicals. Those free radicals are basically everywhere, so it's kind of impossible to avoid. They're in the food that you eat. They're if you have strenuous exercise, stress, or even the sun's rays. So what happens when those free radicals go into your cells? It kind of bombards your cells a lot, so it damages your membrane, and it also, if your nerve 2 isn't activated, it can lead to cancer, it can lead to aging and degenerative disorders like MS. And nerve 2 also upregulates anti-inflammatory genes. So the nerve 2 pathway can be activated by many things like blueberries or green tea. But now we're just going to focus on how MMF and DMF, or basically Tecfidera, is affecting the nerve 2. Don't focus too much on the left side, I'll just kind of explain it later. But when Tecfidera goes into your system, it goes and activates the nerve 2, and the nerve 2, which is in the cytosol, it goes into the nucleus, and then it goes and it binds to your antioxidant response elements, or your ARE, and then once it binds, it releases the proteins that are antioxidants or protect your cells. So the activation of the nerve 2 by Tecfidera, it has your antioxidants, which go fight your oxidative stress, which also prevent inflammation. You have your cytoprotection, which protects your neurons and your oligodendrocytes. And just the overall, the nerve 2 increases anti-inflammation, anti-stress, and anti-apoptotic factors in your cells. And there are also two other factors what Tecfidera can be doing. It inhibits the NFKB, and NFKB is the main modulator of immune activation, which is where you get your cytokines that cause neuroinflammation. And there's actually, important to note, I was reading it in a study, there's a reciprocal inhibition between NERV2 and NFKB. So it's important that Tecfidera not only inhibits the immune system, but it also kind of, through the activation of NERV2, goes and inhibits NFKB. And there's also, it promotes cell differentiation. It goes, like Jackie said before, MS is kind of affected because it's an overbalance between Th1 and Th2. Th1 cytokines are the ones that are pro-inflammatory, while Th2 are cytokines that are anti-inflammatory. So what Tecfidera just comes and does, it promotes cell differentiation between, it wants your T cells to become Th2 rather than Th1. So it could go again and protect your neurons and your oligodendrocytes, which promote your remyelination. And I was just gonna
So to fully appreciate Tecfidera, we looked at 3 other injection-based drugs and then 2 oral-based drugs. So in 1993, the first introduction of disease-modifying therapies came into rise, and they were all injection-based therapies. A small distinction between injections and infusions is infusions take more than 15 minutes, so you can think of this as kind of like a syringe. But in 2010, there was an influx of oral therapies that came to rise and that were developed and were passed. So it kind of comes down to a person's preference as well as their physiology, to which one they want to do. If you're a more regimented person, you could wake up, take the pill, go to bed, and then repeat. Or if you're a person more prone to forget, it's like the third Wednesday of whatever, and then you have to take it. But another thing to consider is that injection therapies, they typically are longer, so it is a couple weeks or a couple months. So you have to take into account your physiology before you make your decision. So all the drugs had to either apply for a new drug application, an NDA, or a biologics license application, a BLA. And the drugs that we looked at, there was typically a 10-month approval process from the FDA. Like I said, the oral therapies kind of came around at the same time. So the ones that were in competition would be Gilenya and Aubagio, as well as Tecfidera.
Nice job at the names.
Thank you. So this is the cost annually. Tecfidera is the one in red. As you can see, can you guys see that in the back? It's about, most drugs are about $60,000. But so there's a little bit of a $5,000 difference, but at the same time, it's important to note that Lemtrada is it's $158,000 for the first 2 years of treatment. So it's a little bit more expensive.
A little.
Just a tad. So one of the most common things is the gastrointestinal upset. Most drugs have that effect. And like I said before, there's a decrease in white blood cell count, so it makes infections more likely to occur. Gilenya and Aubagio, like I said, are the oral ones. That's the one I'm going to be comparing right now. Gilenya can also have PML, which is the rare infectious brain disease, and Gilenya and Aubagio both can result in liver damage and liver failure. This could be due to the mechanisms of action. The Aubagio reduces proliferation of T and B cells, and Gilenya prevents lymphocytes from migrating past the blood-brain barrier. So this could account for its direct modulation of the immune system, while Tecfidera is more likely indirectly promoting anti-inflammatory behavior.
So in this, the circles are when they have the effect, and the crosses are when it doesn't have the effect.
Yes, sorry. So in terms of comparison, there's 4 things we're looking at. These are all decreased rates. So the relapse rates would be the amount of flare-ups in comparison to a placebo. GD plus enhanced lesions.
I'm sorry, so in the relapse rate, is the high number a good thing or a low number a good thing?
That's a good thing. It cut down the amount of relapses by that percentage. It dropped it by 47%. But there's also 3 other types. There's GD plus enhanced lesions, which measures blood-brain barrier damage. And there's T2 lesions, which measures active inflammation. And this is all in the MRI. It would be the white spots in the MRI. And then there's also T1 lesions, which is permanent inflammation damage. And those would be solid black dots on the MRI. It's important to note, though, when comparing Tecfidera to the other drugs, that Gilenya was compared to a drug called Avonex, which is not in comparison to a placebo. So it's kind of hard to balance out and make sense of the actual comparisons. So as a company, Biogen is doing pretty good. They got the patent until 2020. It's accumulated $192 million in the year 2013, in the first half of it when the drug was first released. The projected value is $3.78 billion by the year 2018. So overall, in conclusion, Tecfidera is a safe oral alternative to injection-based therapies, and at the same time is a competitor in the oral therapies, and it's beneficial for both the patients and the company as a whole.
And it's also important to add that Tecfidera can be taken